Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is 10 practice NCLEX questions. Without delay, let's get started.
When communicating with a client who is experiencing dementia and exhibiting decreased attention and increased confusion, which of the following interventions should the nurse employ as the first step? 1. Using gentle touch to convey empathy. 2. Rephrasing questions the client doesn't understand. 3. Eliminating distracting stimuli, such as turning off the television. 4. Asking the client to go for a walk while talking. The correct answer is 3. Competing and excessive stimuli lead to sensory overload and confusion. Therefore, the nurse should first eliminate any distracting stimuli. After this is accomplished, then using touch and rephrasing questions are appropriate. Going for a walk while talking has little benefit on attention and confusion. A nurse on the geropsychiatric unit receives a call from the son of a recently discharged client. He reports that his father just got a prescription for memantine to take on top of his donepezil. The son then asks, why does he have to take extra medicines? The nurse should tell the son, 1. Maybe the Aricept alone isn't improving his dementia fast enough or well enough. 2. Namenda and Aricept are commonly used together to slow the progression of dementia. 3. Namenda is more effective than Aricept. Your father will be tapered off the Aricept. 4. Aricept has a short half-life and Namenda has a long half-life. They work well together. The correct answer is 2. The two medicines are commonly given together. Neither medicine will improve dementia, but may slow the progression. Neither medicine is more effective than the other. They act differently in the brain. Both medicines have a half-life of 60 or more hours. When developing the plan of care for a client diagnosed with personality disorder, the nurse plans to assist the client primarily with which of the following? 1. Specific dysfunctional behaviors. 2. Psychopharmacologic compliance. 3. Examination of developmental conflicts. 4. Manipulation of the environment. The correct answer is 1. The nurse should plan to assist a client who has a personality disorder primarily with specific dysfunctional behaviors that are distressing to the client or others. The client with personality disorder has lifelong, inflexible, and dysfunctional patterns of relating and behaving. The client commonly does not view his behavior as distressful to himself. The client becomes distressed because of others' reactions and behaviors toward him, which cause the client emotional pain and discomfort. Psychopharmacologic compliance is not a primary need because medication does not cure personality disorder. Medication is prescribed if the client has a severe symptom that interferes with functioning, such as severe anxiety or depression, or if the client has an Axis 1 disorder. Examination of developmental conflicts usually is not helpful because of the ingrained dysfunctional ways of thinking and behaving. It is more useful to help the client with changing dysfunctional behaviors. Although milieu management is a component of care, the client usually is proficient in manipulation of the environment to meet his needs. A client has been diagnosed with avoidant personality disorder. He reports loneliness, but has fears about making friends. He also reports anxiety about being rejected by others. In designing a long-term treatment plan, in what order, from first to last, should the nurse include the following? 1. Teach the client anxiety management and social skills. 2. Ask the client to join one of his chosen activities with the nurse and 2 other clients. 3. Talk with the client about his self-esteem and his fears. 4. Help the client make a list of small group activities at the center he would find interesting. The correct order is 3, 1, 4, and 2. The client needs a stepwise plan for developing a social life. He needs to first work on his self-esteem and reduce his fears of rejection before talking about how to decrease his anxiety and learning new social skills. Helping him choose interesting activities is important before suggesting an activity for him. Then he will be ready to try a structured activity with the nurse present for support and role modeling. A multigravida client admitted to the labor area is scheduled for a cesarean birth under spinal anesthesia. After instructions by the anesthesiologist, the nurse determines that the client has understood the instructions when she says which of the following? 1. The medication will be administered while I am in prone position. 2. The anesthetic may cause severe headache, which is treatable. 3. My blood pressure may increase if I lie down too soon after the injection. 4. I can expect immediate anesthesia that can be reversed very easily. The correct answer is 2. Spinal anesthesia is used less commonly today because of preference for epidural block anesthesia. One of the adverse effects of spinal anesthesia is a spinal headache caused by leakage of spinal fluid from the needle insertion. This can be treated by applying a cool cloth to the forehead, keeping the client in a flat position, or using a blood patch that can clot and seal off any further leakage of fluid. Spinal anesthesia is administered with the client in a sitting position or side lying. Another adverse effect of spinal anesthesia is hypotension caused by vasodilation. General anesthesia provides immediate anesthesia, whereas the full effects of spinal anesthesia may not be felt for 20 to 30 minutes. General anesthesia can be discontinued quickly when the anesthesiologist administers oxygen instead of nitrous oxide. Epidural anesthesia may take 1 to 2 hours to wear off. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. The nurse, while shopping in a local department store, hears a multiparous woman say loudly, "I think the baby's coming." After asking someone to call 911, the nurse assists the client to give birth to a term neonate. While waiting for the ambulance, the nurse suggests that the mother initiate breastfeeding, primarily for which of the following reasons? 1. To begin the parental-infant bonding process. 2. To prevent neonatal hypothermia. 3. To provide glucose to the neonate. 4. To contract the mother's uterus. The correct answer is 4. After emergency birth. The nurse suggests that the mother begin breastfeeding to contract the uterus. Breastfeeding stimulates the natural production of oxytocin. In a multiparous client, uterine atony is a potential complication because of the stretching of the uterine fibers following each subsequent pregnancy. Although breastfeeding does help to begin the parental-infant bonding process, this is not the primary reason for the nurse to suggest breastfeeding. Prevention of neonatal hypothermia is accomplished by placing blankets on both the neonate and the mother. Although colostrum in breast milk provides a neonate with nutrients and immunoglobulins, the primary reason for breastfeeding is to stimulate the natural production of oxytocin to contract the uterus. The husband of a client who was diagnosed 6 years ago with Alzheimer's disease approaches a nurse and says, "I'm so excited that my wife is starting to use donepezil for her illness." The nurse should tell the husband, 1. The medication is effective mostly in the early stages of the illness. 2. The adverse effects of the drug are numerous. 3. The client will attain a functional level of that of 6 years ago. 4. Effectiveness in the terminal phase of the illness is scientifically proven. The correct answer is 1. When compared with other similar medications, donepezil has fewer adverse effects. Donepezil is effective primarily in the early stages of the disease. The drug helps to slow the progression of the disease if started in the early stages. After the client has been diagnosed for 6 years, improvement to the level seen 6 years ago is highly unlikely. Data are not available to support the drug's effectiveness for clients in the terminal phase of the disease. When obtaining a history from the parents of a child diagnosed with diarrhea due to salmonella, the nurse should ask the parents if the child has been exposed to which of the following possible sources of infection. 1. Non-refrigerated custard. 2. A pet canary. 3. Undercooked eggs. 4. Unwashed fruit. The correct answer is 3. Diarrhea related to Salmonella bacilli is commonly spread by raw or undercooked fowl and eggs, pet turtles, and kittens. Food poisoning caused by Staphylococcus species is commonly spread by inadequately cooked or refrigerated custards, cream fillings, or mayonnaise. Psittacosis, a respiratory illness, may be spread by canaries. Contaminated, unwashed fruit is associated with typhoid fever, a disorder rarely seen in the United States. Which of the following will be most appropriate for the nurse to teach the mother of a 6-month-old infant hospitalized with severe diarrhea to help her comfort her infant who is fussy? 1. Offering a pacifier. 2. Placing a mobile above the crib. 3. Sitting at crib side talking to the infant. 4. Turning the television on to cartoons. The correct answer is 1. Typically, an infant hospitalized with severe diarrhea receives fluid replacement intravenously rather than orally. Oral fluids and food are usually withheld, although activities such as placing a mobile over the crib, speaking to the infant, or turning on the television may provide distraction for or helping calming the infant. A fussy infant receiving nothing by mouth is usually best comforted by providing a pacifier to satisfy sucking needs. When teaching the parent of an infant with Hirschsprung's disease who received a temporary colostomy about the types of foods the infant will be able to eat, which of the following would the nurse recommend? 1. High-fiber diet. 2. Low-fat diet. 3. High-residue diet. 4. Regular diet. The correct answer is 4. A regular diet would be recommended for the child with a colostomy. No special diet is needed. High-fiber foods, such as fruits and vegetables, should be minimized because they increase the bulk in the stool. Fat is necessary for brain growth in the first year of life. A high residue diet would result in bulkier stools and increased gas production, which will collect in the colostomy bag. Therefore, a high residue diet is not indicated. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.